Hello, and welcome to Web Relates. Today we're looking at the AskReddit subreddit, where Baby Hippo has asked, Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what's your story? The Imaginary says, I'm a pharmacist. One evening shift I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. The man says, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Okay, I'm assuming there was an accident or it was unprotected. How long ago did it happen? Last night, at 7 p.m. on the couch. Well, okay, too much information. I just need to know approximate time to know if Plan B will work. We have this medication called Plan B, and since the incident happened within 72 hours, the man says, oh yes, I got that for her already yesterday, right after we finished. We want to know if there's anything we can do to know if she's pregnant now. And I said, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period. And if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results. That would also not be until a couple of weeks at least. And he said, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin, minerals, food? I said, she's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. What about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? No, sir. There isn't anything you can take now. Bruno Geras says, 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and I've done this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't or wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back. Patient provided improper specimen. I'm beginning to sense a theme of the most consistent problem the doctors are dealing with. Very attractive says, physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery. Showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly angry at me, as if it was all my fault. Actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So, to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault? Never saw him again. Toxdoc says, working midnight in the ER. Family brings in a 4-year-old at about 2 a.m. I ask them what's wrong. They say, ask him, the 4-year-old. He said he needed to see a doctor. Okay, did he say anything was wrong? No, he said he needed to see a doctor, so we brought him. A quick back and forth that firmly establishes that they actually showed up to the ER at 2 a.m. purely because the 4-year-old said he needed to see a doctor and they don't know why. So I asked the child, why do you need to see a doctor? And the kid says, "The doctor has suckers." To be clear, it is the parents who lack sense, and not the kid. The parents could have investigated more, but I suppose it's better safe than sorry. I just suppose the ER was unnecessary. Monk Big T says, "Not a personal experience, but one from a colleague of mine. I only saw the pics. So the 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist/arrhythmologist are scheduled so that they may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answers any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without formal warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains that he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it, with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis, or any other health problem that may appear for that matter. Tatenk says, "EMS here. Had a diabetic in his 30s to 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar, it only read as high, meaning it was over 700 for the glucometer to not read it. Upon seeing this, he asked me if that was high, and then went, 'Is this because of all the ice cream I ate?' Played Facebook Messenger video with his girlfriend the entire time. Met him later at the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off his bandage covering his IV, and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that, hopefully, by the time he got it off, it would have clotted enough for him to not end up exsanguinating himself." Our last comment is by Bob Dave. "My wife is an anesthesiologist. When training junior doctors, one of the things she has to reinforce over and over again is that you never leave drugs unattended in an unsecured area in a hospital, even for a moment, because some people see drugs and think, fun, and then take them, even if they don't know what they are, and they just raided a trolley or picked up a syringe off a bedside table. And then, because the drugs used for anesthetics in hospitals are quite serious, those people quite likely end up dead or vegetables. And this has actually happened more than once in hospitals she has worked in. The amount of redundant care that has to be taken is insane. All of these comments remind me of that old story about designing a bear-proof trash can, where the park ranger says there is a significant overlap between the smartest bear and the dumbest tourist. Alright, that's it for today. Thank you very much for watching, guys. If you enjoyed the video, please like and subscribe to the channel. Until then, I'll see you in the next one. Cheers!